Hello, I'm Chris Elstoft and I'm talking today with Dr. Kiran Martin, the founder and executive director of Asha in India. I'm a member of the Australian Friends of Asha and I've known Dr. Martin since 2015 when I was posted to New Delhi. And Asha was born there in a health crisis. This was a cholera outbreak in 1988 when Dr. Martin responded, and she subsequently founded Asha, which means hope in Hindi. And Asha's gone beyond health now to provide services in education, in water supply and sanitation, women's empowerment, many other areas. But this year, 2020, it's confronting its probably most challenging crisis, COVID-19, which has really rolled through India in a massive way. So I thought I'd take the opportunity of being in northeastern USA, where Dr. Martin is as well, to find out about how Asha has confronted the challenge of COVID-19. Kiran, it's really lovely to see you again. So nice that we're here together in Cambridge, in Massachusetts. Welcome. Nice to see you.
Thank you so much, Chris. I never imagined that we would cross paths in Massachusetts on a cold day like this, but it's absolutely wonderful to see you.
Thank you. And can you tell us about how COVID has impacted Asha and its communities in Delhi?
So Asha has been working among 91 slum colonies and covering a population of 700,000. And to tell you honestly, in the Asha slum communities, the economic crisis has come first, and the health crisis has come second. Most people living in the slums work as day laborers or maidservants or drivers or local tailors, and they earn a very tiny wage, and their lives are very fragile. And they really hardly have any savings. They're very low paid as well. So when the crisis hit, within days families went into starvation. They had no money left at all, and it was very alarming to see that financial distress. The second thing, of course, is its dramatic effects on the healthcare of our communities. And so of course COVID is there, that we all know, and because slums are places where the population density is very high, and people are living cheek by jowl, it's bound to have its effect in that population, but it goes way beyond that. Because there's so many non-COVID interventions that were very critical to life in slums and the health of slum dwellers, and those all vanished because all the hospitals weren't available to our patients, and so elderly patients with diabetes, hypertension, they couldn't get their treatment. Children, young children who were in need of immunizations, all that stopped, and we have public toilet blocks in the slums, and those became dirty within 24 hours because no one would come to clean them. I'll just give you an example of this man. His name is Lal Muhammad, and he lives in a slum in the area of Selampur, which is in the eastern part of Delhi. Very poor community, and he's got this post-polio paralysis, and so he has a disability in his right lower limb, and he has this cycle rickshaw which is adapted to somehow ride, to get some money. And he was anyway very poor. He was paying 50 rupees, which I think is equal to approximately $1 Australian as rent, and earning 200 rupees, which is about $4 Australian. So you can imagine for a family of 6, that kind of poverty. And when the pandemic hit, there were no rides available, and he just, his family fell into starvation.
And how has Asha been able to support him?
So what happened, we actually literally came into action on the next day of the lockdown. The lockdown was announced on March 25, and we were there the next day. And what happened was that we mobilized an army of what we call Asha Corona warriors. These are all young people who had already been part of the Asha family because we had helped them get to university. And it was important that young people came forward, so we gave out a call for help. And Chris, within 24 hours, we had 300 people coming forward, all these young people from all the 91 slums, not leaving even one behind. And they said, we will go forward. So we organized them. And then the first thing they did to people like Lal Muhammad, I mean, he represents lots of people who were affected very similarly, is to go around explaining what COVID was and the importance of masks and washing your hands and so on. But while they did that, they were really alarmed to see the desperation. So we then decided we had to give emergency cash. It was so important for them to be able to even get gas and buy milk, and then just immediately after the emergency cash rollout by Asha, we started giving them food parcels. Just every family that needed food parcels, especially the elderly, the vulnerable, women with young children, disabled people, people who had absolutely no money. So we rolled out thousands and thousands of food parcels, and it was a massive operation because procurement was a problem. Back then, in those days, if you remember, the procurement chain had broken.
Yeah.
So
everything was closed, I guess.
Everything was closed, and so then the entire administrative team of Asha had to come in order to create the procurement chain for such a massive operation. So that's how we really began helping them.
And beyond medical supplies and cash interventions, you've also tried to create a mindset change in these communities at the same time. Tell us a little about that.
Yeah, so I also noticed that the children were going into severe malnutrition just over time, because children are so vulnerable, as you know. It doesn't take them very long to go into malnutrition if they are not given enough calories. And so I felt that I must address this issue, and so I started this malnutrition clinic for children, and I also created this sphere-shaped laddu, which is what we call it in India, but it's basically a sweet protein ball. And it's really delicious. So the women started coming to the centers, and I encouraged the women to sit with the children, feed them these laddus, and also give them cuddles and give them a lot of love, because the children were starved for love and affection. And it was very sad to see that. So that gave them an opportunity not only to get extra calories, but also to spend time with their mothers. And then the second thing that was really important to set the tone for was this whole idea of hope. I mean, the word Asha in Hindi means hope. And I have always believed that hope can bring light in the darkest of places, and it can bring in so much resilience. People begin to realize that this is not the end of our lives. There's a lot that can happen. And so our warriors were so optimistic. There was so much energy. The team was filled with enthusiasm, and that tone that was set for great energy, enthusiasm and hope transmitted all the way to the various communities. And I could see the light in their eyes, and I could see that they hadn't given up completely. And I do have to say that I'd like to give it to the warriors, because it's not an easy thing to right in the midst of a pandemic where there's nobody around in the slums. They were brave. They had the fortitude and the courage to go out, and I think that came from the hope that they had always had in Asha, to be able to go to the front lines.
And you spoke about these young people. Many of them, I guess, are university students. How is your program to get high school students into university going? Has that been disrupted by the pandemic?
Terribly. So I was really worried about this, because that was just around the time when our high school students were taking their national level examinations. And so the pandemic literally hit in the middle of their examinations. So some of their examinations they couldn't take because the lockdown happened. So I was going, what are we going to do? But we quickly mobilized our forces, And we, of course, most of these young people don't have smartphones and they have no access to internet, and everything went online. Taking an exam had to be done online, applying for university had to be done online, and so these kids have no smartphones at all. So we then mobilized. We had to work overtime to get lots of seniors who were able to have access to internet data and Wi-Fi and help them with the online process. But I'm very happy to tell you that we've had some of the most phenomenal results. I never expected, but like our topper has got 96%.
Wow.
Class 12 topper, and she has already been admitted to Delhi University, and she's going to be doing an honors in English. And so we've already had about 55 young people who are at university. The process is still on, filled with challenges, but they've got the scaffolding of the Asha team and warriors, and so we are confident that we won't allow all this talent to go to waste.
That's great. And how have the Friends of Asha communities in Australia, the UK, the US, how have they helped, and how can we help in the future?
They've been really phenomenal. Before I even give you an answer to this, I just wanted to give you a little idea of the figures. So Delhi has a population of 16.8 million. That's according to the census of 2011. And as on 28th October 2020, Delhi reported 3,70,014 cases. So therefore the positivity rate was 2.2%. This is definitely an underreported figure, but whatever figures we do have, that gives us this positivity rate. In the Asha communities, where we serve a population of 700,000, I think I can say with a fair amount of confidence that except for asymptomatic cases where we just could not even have any idea of whether they had COVID or not, but for all of those patients who demonstrated symptoms were tested, and the total number of COVID positive patients were, as of 28th October, 545, which means that our positivity rate is 0.07%.
That's very low.
I was really pleased when I saw that.
So are you testing a lot in the communities?
Yeah, I mean, like, we have an entire protocol that we have set up, and because we've got such good relationships, we've got a system and structure in place, and we don't leave a single person behind. We can make sure that anybody who's got flu-like symptoms or fever, etc., is identified. And we've got this system of giving pulse oximeters to all these patients, and then of course we get them tested, etc. And if they require quarantining, then if they are at home, mostly they can't quarantine at home just because their homes are too tiny, and so they have to go somewhere else. Government encourages them to go to another facility, and if they require to be hospitalized, then we make sure that they are hospitalized. So we do look after them and their families, and we do quite rigorous follow-up.
Okay. And then how have the contributions from the Friends of Asha in the United States, in Australia, in the UK, how has that helped, and how can the Friends of Asha groups help in the future?
Yeah, absolutely. This has been so remarkable, the way the Friends of Asha in various countries have come together to partner with us to provide resources for all our needs. So we've got Friends of Asha in the US, where we are right now. Actually, we are sitting at the home of Dean David Hempton, and his wife is the treasurer of Friends of Asha USA. And we've got obviously Friends of Asha Australia, and the past governor of Victoria, Alex Chernov, is the founding patron of that organization, and the current governor is the patron. And so we've got a wonderful group, including of course yourself, Chris, and then we've got Friends of Asha in Great Britain, and the patron of that organization is Lord Christopher Coxworth. And then we've got some very amazing board members that have been running this organization. And then we've got Friends of Asha Ireland. Apart from that, we've got other partners such as the Australian High Commission, and of course we worked together so closely when you were there, and they've been amazing. So all of these different groups have raised money, raised resources, sent us messages of encouragement and hope, and said to us that they'll stand with us always. So we are spending about $150,000 a month. And that is because we constantly need PPE, we need masks, we need the groceries that have to go out to all these families. We keep giving them cash as well, depending on their circumstances. They need refills for gas, and all of these and medicines, because we're running so many different clinics, and the medicines we're giving completely free, because there's no question of asking them to pay for medicines at a time like this. And there's so many, you need micronutrients, you need to make sure that every illness which is non-COVID related is taken care of at Asha centers, since they have nowhere else to go. So for all these things, this is approximately what we're spending. We're probably going to spend more, and we're very, very grateful to all these different partners who have, in spite of their own difficulties, I know that everybody is suffering. They have really demonstrated a great deal of compassion towards people in the slums. But the needs are growing and expanding because of the way the pandemic is evolving, and I don't think that we're going to see an end anytime soon.
And beyond Asha, other organizations, the Indian government and others are also active in the slum communities as well. Can you tell us a little bit about how your work plugs in and how it relates to government programs?
So government kicked in a little bit late, because in the beginning there was a lot of confusion. It takes time, right, for people to even get their heads around the fact that the whole country is locked down. And when people went out to work the next day, they were beaten by the police and sent back home. But I think it took the government approximately 3 weeks to kick in terms of being able to set up food stations. And NGOs did also do the same thing. There were a lot of charities, but they were late responders for various reasons, which are also understandable. But the problem was that because in the slums, there's so many lanes and by lanes, and obviously the toughest are going to be able to get what they need the fastest. So we found that at the food stations, all those who were fit and well would reach before the food reached, and then they would be clamoring all over, just to get that bowl of rice and lentils or whatever the government was offering. And there was food falling over on the floor and falling in your hair, and I mean it was a very undignified sight, and I felt very concerned for the most vulnerable who couldn't get to those food stations. So while the government and NGOs have definitely done a lot, I think that because Asha was already had such a good relationship, Asha knew the families, the Asha team and warriors were able to identify the most vulnerable, such as the disabled, the elderly, the really poor, the women who are pregnant who can't go and stand in a long line like that. They've got little kids, the people who can hardly walk, so many of them had become so weak from starvation. So I think that Asha was able to enter the immediately and also intelligently be able to provide relief and interventions that were appropriate to every family and every person.
So I'll join you in encouraging people in Australia and in the UK, Ireland and the US to continue to be generous with Asha. It really does make a huge difference for people who've got very few opportunities to see themselves through one of the most difficult times in Delhi. Well, Kiran, thank you very much for meeting me this cold fall afternoon, and I know you're travelling back to Delhi shortly, so travel well, and all strength to you and the Asha warriors in your mission to help these vulnerable communities in Delhi. All the best.
Thank you so much, Chris. It was a real pleasure talking to you. Thank you.